Hi, everyone, and welcome to our August Virtual Connect with Network Health event. We're so glad that you are here with us today. My name is Kelli VanderWielen. I am the Community Engagement Coordinator here at Network Health, and we're really looking forward to spending time with you and appreciate you joining us for this educational event. So it's really hard for me to imagine that in just a few weeks, we'll be saying goodbye to our Wisconsin summer and hello to fall here in Wisconsin. It's definitely one of my favorite times of year with all of the beautiful color on the trees, pumpkins, of course, and you can't forget about the pumpkin lattes and all the outdoor festivals as well. But I know fall is also a time when we start to think about the ways that we can protect ourselves and our families from the common viruses such as flu by getting our vaccines. So today, we are lucky to have our two incredible Network Health clinical pharmacists, Beth and Sarah here, who are going to join us shortly. They're going to share some helpful information with us regarding ways to protect ourselves from the common viruses and infections by getting vaccines. Before we get started, just want to give you a little snapshot of the things that you can expect during today's presentation. So first, I'm going to share a little bit of information about Network Health. Next, I will introduce you to our special guests, Sarah and Beth, and then we'll finish up the presentation by answering some questions, some common questions. But so we'll get started here first by talking a little bit about Network Health. So today's event gives us here at Network Health the opportunity to connect with you and also support one another along our health and wellness journey. Whether we're in a virtual room or presentation, or even at an in-person event out in the community, our connection with you is important. For 4 decades, Network Health has established strong roots throughout Wisconsin by putting our members first. We're co-owned by 2 high-quality health systems, Freighter Health and also Ascension, Wisconsin. And at Network Health, we take the extra steps to make health insurance affordable and also understandable so our members can make the most of their coverage. Each day, Network Health and our employees improve the lives of local business owners, individuals, and families as we pursue our mission to create healthy and strong Wisconsin communities. We put in the extra effort because we want to and not because we have to. So again, I just like to thank you for joining us and for choosing to spend time with us by being a part of this presentation today. All right, so next, I'd like to introduce Sarah and Beth, who again are clinical pharmacists here at Network Health. Hi, Sarah. Hi, Beth.
Hi.
Thanks for being a part of this presentation. I'm going to turn things over to you at this time.
Sounds good. All right, thank you, Kelly. First thing I'm going to chat about here is influenza, which is commonly known as the flu. It's a contagious respiratory illness affecting the nose, throat, and lungs. It's thought that it's spread by tiny droplets from either talking or cough. Typical symptoms include fever, cough, sore throat, runny or stuffy nose, headaches, fatigue, and body aches, just that general feeling, lack of better words, that you've been hit by a truck. Not everyone has all of these symptoms, or even everyone has a fever, but these are just the common symptoms. Flu season typically starts in October and peaks between December and February, but it can go until May. This flu season looks like it could be particularly bad, just based on what's happening on the other side of the world, such as in Australia, who is currently having their flu season right now, and they're experiencing a pretty nasty flu season. Could be a number of reasons for that. Historically, a strong flu season follows a weak flu season, but also for the last year or two, we've had so many COVID precautions, people in masks, people wiping down and sanitizing everything. These things definitely help stop the spread of the flu as well. So knowing what we know and what's happening over across seas is definitely something, good evidence to get your flu shot this year. I'm going to go to the next one. So should I get the flu vaccine? Short answer is yes, everybody should get the flu vaccine. Basically, any individual who is 6 months and older should get the flu vaccine. It's especially important for people who have a higher risk of serious complications from the flu. Those people with underlying health conditions such as asthma, diabetes, heart disease, lung disease, people who are over 65, typically people over 65 bear the brunt of the morbidity and mortality from the flu. However, people who don't fall into these categories can and do get seriously ill from the flu. People who care for children younger than 6 months. Babies under 6 months are too young to be vaccinated. So it's important for the people around them to be protected in order to protect them. And healthcare workers definitely need to get vaccinated as well. And if you want to go. All right, so the type of flu vaccines here, there's a couple different ones on the market. Right now, they're all quadrivalent flu vaccines, which that means is there's 2 strands of the A flu virus to protect you and 2 strands of the B. These are approved for people 6 months and older, and they're typically given in a shot in your deltoid or in the thigh for children. So these are the typical flu shots you think of that most everybody gets. There is a nasal vaccine called Flu Mist available for people ages 2 through 49. But however, this is a live vaccine, so it excludes those who are pregnant or immunocompromised. The typical quadrivalent flu vaccines that most people do get are killed or inactivated vaccines, meaning you cannot get sick from the flu vaccine. What I like to tell people is it's just a tiny piece of an inactivated flu vaccine. It's not going to cause the flu virus. A good analogy is if I gave you a piece of a car, such as an exhaust pipe, and told you to go drive a car and build a car and drive it, you wouldn't be able to. So the flu vaccine will not make you sick. There are vaccines for people 65 and older in that we really want you to try to get one of these 3. In the past, it was just get whatever vaccine that's available. But after looking at the data, there's now the recommendation that people older than 65 should get one of these, for lack of better words, super vaccines. There's 2 of them, the high-dose flu vaccine that contain higher amounts of the antigens. And there's another one, which is called an adjuvated flu vaccine called Fluad, which contains a substance so your body produces a stronger reaction to the vaccine. This is important because as we age, our immune system gets weaker and we need more of a dose of a flu vaccine in order to get a robust response to the virus. There are vaccines for people with egg allergies. So if you had an egg allergies, there are 2 vaccines on the market that you can get if you are allergic to eggs. They're just growing in different technology. Also, I didn't touch on when is the best time to get the flu vaccine. So it takes about 2 weeks for the flu vaccine to fully protect you. Seeing that flu season typically starts in October. Ideally, September, October are the best times to get that flu vaccine. We definitely, if you can, get it by the end of October. However, if that doesn't work for you and it just doesn't work with your schedule and it's November, December, and you still haven't gotten your flu vaccine, it will still protect you to get it during those months as well. So that's all I had about flu vaccine. Kelly, do you know if there's any questions?
Sorry, I couldn't find my unmute button, Sarah.
Yeah.
I actually had a question, but you answered it already with your analogy of the car and the exhaust pipe. So I was going to ask about, if it is common to get sick after you receive the flu shot. So
yeah. Nope. If you get sick immediately after getting the flu shot, you're just unlucky and caught a different virus.
Yeah.
People give you the flu.
Okay. I like that analogy. I'm going to have to use it with my kiddos too, I think. Thank you. All right, we can go on to the next topic, which is shingles. Beth, take it away.
Thank you, Kelly. My name is Beth Coopman. I'm one of the clinical pharmacists here at Network Health, and I'm so glad that you joined to learn a little bit more about vaccines. It's really important to protect ourselves and our community. Specifically, I'll talk about shingles. Shingles is a viral infection. It's caused by the varicella-zoster virus, which is actually the same virus that causes chickenpox. And they say if you've had chickenpox, you're at risk for shingles. So what their estimate is more than 99% of Americans born before 1980 have had chickenpox, even if we don't remember having it. They also say about 1 in 3 people in the United States will develop shingles during their lifetime. So you can see there's a value to this vaccine. After you've had chickenpox, what happens is that virus can live in our nerve tissue, and basically over a year span, it can be reactivated. And when it becomes reactivated, it's known as shingles. And when we get shingles, and as you can see in this picture, it causes a rash and it's painful. and some blisters can appear too. It can itch and burn and tingle and feel even numb in some instances. Some people can have a fever or headache or sensitivity to light and fatigue, and it can appear anywhere in the body, but it's most commonly a strip of blisters that wraps around the sides, either the right side or left side of our torso. And as we get older, unfortunately, as your immune system weakens and we get older, the complications that you can get from getting shingles increases. So vaccines can help reduce the risk of shingles, and also early treatment can help shorten the shingles complication that you may have. So the shingles complications that can occur, about 1 in 10 people who get shingles develop nerve pain that can last months or years after the rash goes away. This is called post-herpetic neuralgia, and it is the most common complication from shingles. A less common complication, but quite severe, can be that shingles that involve the area around the eye. This can cause vision changes and even as bad as blindness. So, and very rarely, shingles can lead to pneumonia, hearing problems, and inflammation in the brain, which is rare, but again, those are very serious things when they do happen. Next slide. So should I get the shingles vaccine? Well, it depends on your age, but the short answer again is yes. Shingrix is over 90% effective for preventing shingles, and that is a really great percentage for vaccines. Previously, we had Zostavax, which is about 50% effective, and we were really happy with that. That's all we had, though, at the time. So now we have a new and improved shingles vaccine that is very effective. You should get the Shingrix vaccine if you've previously had, again, chickenpox. Even if you've previously had shingles, you can still get it. If you've received Zostavax, we still recommend you get Shingrix. And if you've had the chickenpox vaccine, which is known as Varivax, those would be all reasons that you would want to get the shingles vaccine. The age is for 50 and older. They have a new indication for those 18 and older if you have immune suppression. So immune suppression can be cancer, HIV, AIDS, being on immune suppressive drugs, maybe after an organ transplant. So as you can see, there's a lot of benefits to the shingles vaccine, and it definitely is a very valuable one to have in our arsenal of protection. Next slide. And so the Shingrix vaccine series is 2 doses. You get a single dose on day 1, and then 2 to 6 months later, you would get your second dose. The great thing about the shingles vaccine, the Shingrix, is that it can be co-administered with other vaccines. I like to recommend to have 1 dose in each arm, so we know if a person has a reaction, we can really understand which vaccine caused the reaction. But the nice thing about the Shingrix vaccine is it can be co-administered with other vaccines. As far as side effects go, they're pretty typical side effects for any vaccine that we have. Anytime we're doing a vaccine, our immune system gets revved up, and it takes some effort from our body to get that memory. And so having some fatigue, some soreness at the site of the injection, that's very common. Sometimes fever. There are a few rare reactions, or allergic reaction, like swelling of the tongue or throat. That would be emergency room situation. That's very rare. Sometimes you can get a skin rash, which is treatable with things like Benadryl. As you can see, again, those are very rare type reactions. Comparing the side effects with the effectiveness of the vaccine, the benefits of getting the vaccine outweigh the potential side effects, and those risk of suffering long-term complications, again, can be, you can avoid that by getting the vaccine. So I'm very happy that this vaccine is in our arsenal. Was there any questions for me on shingles?
Yes. Thank you, Beth. I have one question. I'm wondering, is there a booster for shingles once the Shingrix vaccine series is complete?
That's a really good question. When you get your shingles vaccine series, the 2 doses, you are protected for your lifetime. So there is no booster.
Great. Wonderful news. All right. Thank you so much, Beth. we will move next into COVID vaccine, and I'll turn it back over to Sarah.
All right. So right now, the current COVID vaccine recommendations are individuals 6 months and older should get all doses in their COVID-19 primary series. The age group from 6 months to 5 years was the most recent approval. The mRNA vaccines, such as the Pfizer and the Moderna, are preferred over the Johnson & Johnson vaccine. As far as boosters, people aged 5 to 49 should have 1 booster. People aged 50 and older should have 2 boosters at this point. Even though the virus has evolved since these vaccines were brought to market, it is still your best shot at reducing the severe complications that can occur with COVID. And so we do have updated COVID boosters, and we had to make these slides ahead of time. So this is kind of an evolving, slightly out of date slide, just slightly. So there's going to be new vaccines available this fall that will include a component of the Omicron subvariants. So it will contain a component of the original vaccine plus the Omicron subvariant, which has been circulating as of late. The hope is that this will broaden immunity. These new shots will be used as boosters. So if you're on the fence and still waiting, you definitely should still get your primary COVID vaccine series. They're aiming to be original, so we heard October. This is the part where it is a little out of date. It does look like the CDC is meeting on September 1st, and there should be a decision about when these shots should be rolled out. I've heard everything from after Labor Day to October, so it depends on which shot is available first. There's going to be one from Pfizer, which is ages 12 and up, and then there is going to be one from Moderna, which is ages 18 and up. Right now, if you have had a booster of the COVID vaccine or a COVID infection, you probably want to wait about 3 months before getting your next booster, just because you do have some natural immunity there. And then, where do I get my vaccines? The flu vaccine you can get at your doctor's office, pharmacy, flu clinic. We do have some network health flu clinics that we sent out invitations for our Medicare members, and Kelly's holding up the postcard that you may have received in the mail. These were sent out to our Medicare members to get shots at some local pharmacies on specific days. However, if that doesn't work for you, it doesn't matter. You can get your flu shot anytime at any of these places. It's a pretty easy one to find. In addition, if you're not a Medicare member, you won't be turned away if you show up. We want you to get your flu shot. Shingles vaccine is a little more restrictive. If you are a Medicare member, we do want you to get that at the pharmacy. This will save you money. Your cost share of the vaccine is much less to get it at the pharmacy. If you have commercial insurance or are self-insured, it doesn't matter if you do get it at the pharmacy or the doctor's office. As for the COVID vaccine, kind of like the flu vaccine, lots of places to get it. Doctor's office, pharmacy, county-run clinic. There's no cost difference to you at any of these sites. We just want you to get your vaccine. For questions on coverage or questions on which vaccines that you do need, please call our Network Health Pharmacist line or the number on the back of your insurance card. And here we have our Network Health Pharmacy team. We are here in Menasha and Brookfield to answer your questions. Our pharmacist line is a dedicated line that will go directly to one of our clinical pharmacists here, or you can always reach us by using our email address listed on the bottom. All right, any further questions, Kelly?
I just have one, and it's a little off topic, but with, the change in everything going on right now in the news, we hear a lot about monkeypox. I'm wondering, can anyone or everyone get a monkeypox vaccine right now?
Kelly, I'll take that question. I wanted to preface that it's August 25th, and this is a very evolving subject at this point.
Yeah.
But at the moment, not everyone is getting the monkeypox vaccine. It's really been restricted to people who have been exposed to monkeypox and people who may be more likely to get monkeypox. There are some pretty specific definitions of that. They talk about public health officials, in contact with someone with monkeypox. And then it does also talk about, as far as sexual partners too, not to get too descriptive, but if you've been encountered within the last 2 weeks with a person diagnosed with monkeypox, that would be a reason. And it does get, again, more descriptive as far as that goes. But if you have any questions that you might be eligible or are worried about getting that, you can contact either your healthcare provider or your local health department to see if you would be a candidate.
Okay, thank you.
No problem. I wanted to actually say one more thing. Monkeypox is something that can be quite uncomfortable, fever, aches, and having a rash that can be quite uncomfortable. But that resolves in about 2 to 4 weeks for most people. When we compare it to something like COVID can wind up in the hospital. You can wind up intubated with a ventilator, unable, to breathe on your own. And so the severity of COVID is much, much more serious, and monkeypox is not necessarily a deadly situation like COVID is. So I think that's one thing that we kind of feel a little peace of mind from.
Yeah, absolutely. Well, thank you for sharing that information. It's really helpful, Beth. Appreciate it.
Thank you.
All right. Well, again, I'd just like to thank both of you and our viewers today for tuning in. Would also like to remind anyone that if you're interested in joining Network Health for upcoming virtual events, please email me directly. My email is up on the screen now. I'd be happy to hear from you and share some upcoming event information with you. We also post information out on our Network Health Facebook page. So if you haven't already liked us out on Facebook, please make sure to do so. Again, Sarah, Beth, thank you for being here. And we want to thank everybody for joining us. We hope you have a great day, and we'll see you again soon, hopefully. Thank you.
Thank you.